I want to thank Larry for pulling together this amazing panel. I think it's only at Medicine X that we have a futurist, an e-patient, and a sexual health expert all in the same room. So, I guess I just want to more properly introduce our panel today. We have Bercy Mesko, who's a blogger and a self-described medical futurist. He's the founder of Webcina, which is one of the premier curation sites on the web. We have Dave DeBronkart, effectively the godfather of patient empowerment, tireless champion for patients. Yeah. He's an author and a visible public figure. To say the least. And then Leah Millhiser is a director of the Female Sexual Medicine Clinic at Stanford. She has a particular interest in quality of life and sexual health in cancer survivors, if I'm not mistaken. Mm-hmm. And she has 2 frogs, which is kind of cool. I think what we'll do is just have a little discussion. I think this is a great opportunity for you guys to come to the mic too in a few minutes if you have some burning questions for these guys. We'll also be getting some questions coming in from Twitter if you're listening that way. Nick will be handing those to me. It's an interesting contrast here because Leah has just really started her journey as a public physician. She's been blogging for, I guess, a few months now, right? Mm-hmm. And sandwiched on either side are 2 real experts who've been visible in the public space for a long time. So we might be able to show some interesting contrast. You 2 guys on the end, this issue of celebrity in the public space is something that's really interesting to me. As democratized media has made us kind of all public figures, patients like yourself, Dave, and other e-patients have really achieved celebrity status. How do you balance kind of your mission, personal mission, with kind of your newfound role and newfound authority? I mean, I think there are challenges, certainly, right, that come with sort of being a thought leader, a key opinion leader, and I mean, aren't there some challenges that come with that when you're, you know?
It's funny, somebody asked me earlier this week if I've been syndicated anywhere.
Yeah.
And I responded by saying, I am way too irregular and unpredictable to have any kind of an agreement. But that's one of the beautiful things about social media is I blog when I can, you know?
Right.
And, you know, I mean, the only potential downside to me has been, I mean, really the only one, has been that, you know, if I do something really inappropriate, which has been known to happen, more people notice.
Yeah.
But that's not a big problem.
Yeah.
But my first point is, Dave is a celebrity himself. I'm just active in social media. I'm lucky from the perspective that, based on my online presence, this presence supports my mission to help even more professionals, even more students about getting closer to social media and their own e-patients. So for me, these 2 different fields support each other. And what I do is, and what I tell my students is, I never do anything online which I would never do in the real life. Therefore, for me, there is no difference between the in-person and social media communication. I do the same things. I say the same things. My channels are all public because I never post things I would never do in real life with millions of people or tens of thousands of people. Maybe that's the basic rule I have in mind. If I post something, a comment, a photo, anything else, and if now millions of people could see that, including my wife, my future kids, my friends, my family, and so on, then it's still okay. If the answer is no for any of these questions, then I would never post it. So there's no difference for me, really, between the online and offline communication.
Yeah, it's interesting when I talk to physicians starting out, this realization that physicians have gone from this real solid existence to this public space. Anyone who's public has an audience, even if it's 25 people, and that brings some real challenges. Certainly not in the level that you guys have had. Leah, what's your real mission? I mean, you've started this blog. You sort of alluded to the fact that you want to sort of correct this issue of misinformation and health literacy. Is that kind of what drove this? Do you have other motivations, or how do you see your role?
So I think it's several-fold, really. One is it was to address some of the inaccuracies I saw, especially for me, it was in menopausal medicine and treating women with cancer, because I feel like, you know, there's so much information out there, and And I think that patients, a lot of them have the knowledge to identify what's real and what's not, what's accurate, what's not. But those patients who really don't have those resources, I feel like these are the people that I was addressing. And it's interesting, I want to just make a comment to a point you brought up about when you go from the private to the public space. It's really interesting for me starting out to have people, I got on Twitter, and to have people send me direct messages addressing sort of some of the points that I'm bringing up in my blog. And when you're blogging, it's a very private, personal thing, and you don't really think about the impact that you're having. So to have people from different countries comment on information is really amazing to me. And you start to understand the impact that social media really does have, not just for your patients, but also the public at large.
Yeah, you realize you have a platform to the world. A little bit about workflow. David Weinberger from the Harvard Berkman Center has said that we're experiencing a crisis of information. And Dave, you kind of got to that with your discussion of liquidity of information. And there's a volume of information that we're all facing, both as physicians as e-patients. How do you guys, especially on the end that are veterans, how do you manage all these inputs? I look at what, Bercy, I look at what you curate just on Twitter. Bercy is one of the most valuable people that I listen to on Twitter because he brings me the most amazing things. How do you do that? How do you do that within your time frame as well as writing a book and doing those sorts of things? I just really want.
That's a key question. I think that's one thing or one skill I had to become very good at, the time management over the years.
Yeah.
So because I've been using plenty of social media channels quite massively, it means that I not only get news from now 420 resources every day through RSS feeds, but by building communities around myself in social networks, I get those news they find interesting every day and they share and like and comment on. So I have to find a way to filter this huge amount of information every day, and I believe I'm having some almost perfect methods, and I can say it quite self-consciously. For example, all my life is organized in one Google document, which is private, only I can access it, obviously. I have different color codes for different projects of mine, different how I write my book, how I manage my own social media channels, how I get news from these channels. So I have one huge color-coded, very specially coded Google document. So I know when I have to be on time, plus I use different channels for different purposes. Even if
channels, what do you mean channels?
For example, Google Plus or Facebook or Twitter can serve the same purpose, but for me, on Google Plus, I only use the communities, which are now, I believe, the best focus groups in the world in social media. I use my blog as my channel from inside my mind to the outside world. I use Twitter as my most important highway of information back and forth, so giving and getting as well. I use RSS feeds for getting news from my favorite resources automatically. I use Google Alerts, so I don't have to go back to Google and do a search for my name, for my workplace, for my blog, for my field of interest, to see whether there are new additions, but they send it to me automatically. I do the same in PubMed. So it took me some months, but I set everything up. So now all the information I need, every pieces, these are getting to me automatically. And I just have to look at one single place, and I know that I will get all the important key information or key piece of information I have to get every day.
Oh, and yeah, so I'm completely different from him. To me, it's just like the whoa, just the stuff.
What was that?
That was the stuff washing. Well, sometimes I say that. What was it? The stuff just washing over me.
Right.
I tried for a long time to filter it the way he does. I know from personal experience, it'd be hard to build an organization that functions the way you do, because a lot of it comes down to the cognitive bandwidth that you personally have. And it also, the Google tools, which are remarkable, makes us completely vulnerable to Google changing their mind. Yeah. You blogged recently about how, well, wait a minute, if Google's going to do away with their RSS, the way you use it, you're screwed. Right. In my case, I have a Google alert for e-patient, e-patient. Well, they changed their logic now, and I get anything that contains the letter E and patient, which is a lot of stuff I don't care about.
Yeah.
So well, and it's interesting. There's what you do is phenomenal. I'm so glad that I'm interrupting myself here, but what you're doing. Do you know Wendy Sue Swanson?
Yes, we met last night.
Yeah, well, But you're exemplifying, what she put out at a conference like this a few years ago is, guess what? There's crap on the internet. It's our job to get out there and counterbalance it, which is thank you, thank you. And how we, the illusion of certainty, which I talked about, the illusion of knowing everything, not to mention that everything can change next week. We just got to, it's very much a matter of not getting on top of it, but riding the wave.
Yeah. Back on workflows, one of the things I found when looking at physicians that's so important is helping them limit who they listen to and what they listen to, especially on Twitter. I think you really have to restrict and be careful about who you listen to. I think that's the most valuable. I think it's Stowe Boyd, the internet theorist, who said that in a networked age, the most important decision you make is who to listen to. So I found that to be really, really important. Dave, you've been around this probably even longer than I have, but is there an echo chamber with Health 2.0? I mean, is there?
Oh, of course.
I see this. We all listen to each other and we all hear the echo of our voice. How do we fight that?
So for those who aren't familiar with the metaphor, an echo chamber is when you get into the point where you've got a circle of people that you talk with and you talk into it and you tend to get the same stuff coming back. And if you consider yourself to be a change activist, that's a problem. And I often liken this movement of listening to patients to other social cultural movements, feminism, civil rights, gay rights. And I know in this, I think often, my years in college in the 60s in Boston, I got exposed to some pretty radical feminist thinking. And then I'd go home to rural Minnesota during summer vacation, and I heard very different conversations. Right. And it took a generation to get through that. And so what I've been keenly attuned to in the conferences that I've gone to in the last few years, we hear the conversation about the role of the patient changing at conferences, but the people I keep an eye on, the people I bump into in the checkout line at the supermarket. All right, and that's why I'm so interested in carrying this beyond conferences. And personally, where I think the best front line for changing what street reality is going to be working through nurses, okay, at the bedside, because they spend the most time interacting. So I've started working with the University of Minnesota on an online CME course for patient engagement. I don't know if that answers your question, but.
You guys have any input on the echo chamber? Lee, you're probably not as experienced with the echo chamber since you're.
Because I'm so new to it.
You're so new to it, but Bercy, do you have?
I might be a bit too aggressive here, but I believe that we have to get through some points during these conferences, and I believe that we have to move on. Now we all understand that e-patients are leading this revolution. We all understand that medical professionals have to take active part in that. I tell them personally, from professors to young medical students, that that's now your responsibility to deal with online tools and how to work with e-patients successfully.
Yeah.
So I believe that we can get over these points, and now in these conferences focus on the real practical users, practical examples and tools. Maybe that's the only thing I find interesting, that we sometimes I feel like we still get back to similar issues, the same issues as before. Like it wasn't so evident now. It is.
It's when I look at what doctors do on Twitter and who they follow, there's a lot of, they're very vertical with the way they see Twitter. They like to follow other doctors and they're quite comfortable in their own. I think we really, part of this, breaking this echo chamber, I think, is to think more horizontally in terms of who we listen to and who we open ourselves up to.
Can I do a follow-up on that?
Yeah.
So I'm always uncomfortable being referred to as a celebrity because it just feels weird. But to the extent,
and I wasn't suggesting.
To the extent that I'm a celebrity in an echo chamber.
Yeah, no, absolutely.
All right, that's,
right.
Well, and that's, so like my TED Talk boomed in the first 2 months. It went to the top half of the most watched TED Talks of all time. And it now is just completely plateaued. Right? There's 300 million people in the United States, and so the 500,000 views is a drop in the bucket. And I mean, we got to get out there and change the world. One of the things I hope we can get to in a few minutes is the aging demographics, because the future of medicine.
Of the web user, you mean?
No. That's the patient world. A whole lot of the future of medicine. One of my college classmates recently said on Facebook that he's having a pacemaker put in. And the reason he's having a pacemaker put in is because twice in the last 10 years there were acute conditions that he didn't die from.
Yeah,
right?
right,
So
right.
I'm the age, when Social Security was enacted, my current age, 63 and a half, was life expectancy. All right, and so somebody my age was 50% likely to be dead.
Yeah.
So we've got this future with a whole bunch of elder people with chronic conditions, right, where self-management, self-awareness, and so on has to happen in the home. And that's going to be a whole lot of social media. And a major factor, of course, is that social media, whether we like it or not, is available 24/7, which in general doctors and medical practices aren't. So.
And do you think, do people give you a pass, Dave, or Bercy, you know, with, you know, in these networks, you know, there is a hierarchy, and people don't want to buck. You want to stay on good terms with the people who are top of the pyramid. And do people give you a pass? Do they challenge you as much? You know, I don't see that as much. I don't see people. Perhaps I'm missing it, but.
For me, mentally, I need food by thoughts every day. That's why I use Twitter. I live in Central Europe, quite far away from the, let's be honest here, the main parts of the innovation revolution. But still, by living online and by using Twitter quite massively, I mean, I'm tweeting every hour, every day, even during the night. It means that I get hundreds or thousands of pieces of feedback every week based on new innovations, just new ideas and new thoughts. And it makes me come up with my own innovations myself. So for me, I am being challenged every single day. But it also means that I have to challenge people. I have to put efforts into that every single day. And that's why I teach my students, without doing this really every single day, again, it won't work. Just like in real-life communication. If you stop meeting with your friends for years, well, it's not going to be a friendship anymore. That's the same in the online channel. It's a bit faster and more interactive, but the concept is the same.
Yeah, talking about being there and being live, what's y'all's opinions on scheduled tweets? Maybe I'm touching a nerve here, but I just recently started using Buffer myself, and I have some thoughts on it. But
that's different, just to make it sure. So I never schedule tweets. I tweet every hour. I schedule tweets, of course, some tweets. But Buffer is different. I never do a thing that I let other services just rotate the thoughts I share automatically, because I believe that I want to change and choose the way and the time and the audience and the hashtag myself for every single tweet of mine. So even if I rotate something, I do it again manually, because I believe that's the only way to get it through, get it across to people who I want to target with it.
Mitch Joel, who is a marketing guru from Twist Image, says that scheduling your tweets is like sending a mannequin to a cocktail party. But honestly, I do a lot of my surfing at, you know, late at night, and so I see something from Wendy or from Suzanne or whatever, and I want to put it on when my audience can see it. I schedule it for 8 or 9 the following morning. Now I'm present, and I can respond back to what people say, but I'm in clinic, and I'm busy, and I'm checking my feed in between patients. So for me, I never thought I would do it, but I just started doing it. Dave, what do you think?
Well, to me, scheduling is appropriate when you're doing something with a particular strategy.
Right.
You know, I mean, chatter, I always say tweets are like champagne bubbles. They pop and they're gone. If somebody isn't there at that moment, they don't see them. So, you know, if you want, like I blog on Forbes, and Forbes is big on the best time to release a post is like 9 to 10 a.m. Right? Because then you get the wake-up traffic and so on. But I'm not terribly strategic about it. And just being myself.
Sorry, and you live in the US. I have to schedule different tweets in a different way of saying for European audiences, and then at night for my US followers. So it's a challenge.
Yeah. Anyone wants to come to the mic, feel free to step up if you guys have questions for any of these guys.
And I want to say one thing on that subject about being challenged, okay? To me, truly one of the most important things I ever learned in science was that any real scientist is always ready to discover there's new information that invalidates what they believed to be true. You know, at the time nobody was certain that atoms, you know, this was a long time ago, nobody was certain that atoms actually exist. But it's a way of looking at things that explains a lot and predicts a lot, but you always have to be ready to have that knocked off. And I mean, I don't even have a master's degree.
And I wasn't suggesting that you weren't ready, but I just wonder whether in this pyramid of authority, and clearly there's a pyramid of authority in these social networks.
I'm always ready, always ready.
Yeah. But I wonder if people do it though. Do people
I don't
really
experience authority? You know, I'll throw a spitball at anybody I want.
Just one short, if I might have one. About this pyramid, I feel like after all these maybe 7 years being quite active in Twitter and having 34,000-ish followers, the responsibility is getting bigger. So when I tweeted something 3 years ago, I just found it interesting, but now I have to think twice before tweeting anything because people might find it important that I just tweeted something, even if there are other people tweeting about these things as well.
This is an interesting question. It just came through. I don't know who it came through from, Nick. What does a patient futurist look like? Wow.
Patient futurist.
Patient
Good question.
I don't know if I can answer that, but
They are sequencing genomes at home.
right.
Yeah.
Yeah.
What's your ideal patient of the future, Leah?
I think a patient of the future is somebody who is using social media, I mean, exactly what's been talked about, and is able to come in with knowledge that they've learned. Again, my big thing is a site that is accurate and comes in with the data and can sit down with their clinician and say, this is what I feel would be appropriate for me. Let's talk about it.
Absolutely.
That's I think, and actually to bring up another point, you were talking about, how physicians interact with their e-patients. Because e-patients, I have to be honest, e-patient is a new concept for me. I've never heard of I know an empowered patient, but the concept of the e-patient, and
You are new, aren't you?
I'm new, so this brings up a point as to how are the medical schools around the country addressing the concept of the e-patient? Because I think it needs to start at the very beginning. It needs to start in medical school, and there needs to be this communication about how social media is changing the future of medicine. And I think what you're doing in the medical school in Hungary is amazing, and I think it needs to be brought to the United States as well. So
Stanford runs a conference.
Amen.
I heard.
It's not part of the curriculum, though, right?
I tell my students we will stop using the expression e-patient very soon because every patient will be an e-patient.
Everybody's an e-patient. Yeah.
Yeah, but again, so like feminism in the 60s, the people who were thinking that way, thinking differently, were in one world, but it took decades, before everybody thought that way. Today, my daughter, the high school science teacher, I'd love to have her meet up with Jack. She says she doesn't consider herself a feminist, but she ran in the Boston Marathon a year and a half ago, the hottest one ever, and said, did you like being in cross country in high school? Because when I was in high school, there were no girls' sports. My high school athletic director quit when Title IX was passed.
Dave has the long view.
I do. That comes from being 63 and a half.
We have a couple of questions over here. Why don't we take the first one?
Okay,
It's Wendy.
thank you. Yeah, I'm Wendy Sue Swanson. Thank you. I have two very quick comments and then a question for Bercy and Brian. I think when we talk about kind of what's true and what's not true on the internet, I think we have to remember that it's by design a dynamic space. We'll never know what percent's accurate and what percent's inaccurate. And controversies will always exist of what is accurate and what is not. And two physicians trained and who believe in evidence-based or consensus guidelines may not actually agree with that, with one particular blog post being accurate or not. I just wanted to put that out there because I think it's a complicated space about where the truth lies for a particular individual. I also wanted to just say one thing on kind of how we use these channels. I love that you all showed, your difference of opinions and ideas of how you use a channel. I think it's another dynamic place that, of course, I've only been on Twitter for 4 years, and how I use it today and how I used it even last year at this conference versus 2 years ago is really changing. And that as we design as physicians and as e-patients and as consumers of healthcare, as we design how we use these channels to get what we need for our communities, those roles will shift and change. And And I think we have to be a bit more respectful about how people use them. So for example, my Twitter feed goes on a children's hospital website. So I have to be really thoughtful about how I engage and what kind of chatter I get in, and how I think about which audience needs to hear something, just like Brian mentioned. So I just want to say that. Lastly, sorry. I just really want Brian and Bercy, I think in particular, and Lee, you can talk about this as well, for the audience to talk about how it is that you're now a self-described medical futurist. You have this career. I'd love to just share how you get paid to do what you do, or how you've created this career. Because one of the big challenges for our rising, eager, and excited physicians of the future and current time is how to really make this work. So I'd love if you could showcase that for us.
That's a great question, Wendy. It's something that comes up all the time. You know, should physicians be paid for their time spent in public engagement? There are a couple of models for this. Wendy, of course, is one. She works for Seattle Children's Hospital. Claire McCarthy has done this in Boston Children's. Do you think we'll get to that point? There's so much time involved.
Well, Wendy, I get paid by magic. To be honest, before I decided to become a medical futurist, I had to realize I had been working like that for pharmaceutical companies, medical technology companies, universities worldwide. So I've been doing that kind of job, but now I just gave it a name. What I have been doing is when they have a problem with digital channels or how to reach their patient or physician audiences, and as I've been using all these channels myself for almost a decade now, I could give them some real practical examples and solutions. So now what I do differently from what I did last year, for example, for these companies, is that over the last year, I've been training myself to really be good at futuristic studies. And I can take a look at the same problem from a very different perspective, from a 20, 30 years perspective, and I can come up with some solutions that they didn't even have in mind before. Maybe that's the only difference, but the way I get paid, it's tricky because on Webicina, as you know, everything is for free. And as long as I do Webicina, everything will always be free for patients and doctors, but not for B2B pharma companies and other technology companies. If they want to get some kind of innovation in social media, they have to pay for that. But the target audiences, patients and doctors, will always get everything for free. So I have this cap, the Webicina Managing Director cap. I have my medical futurist cap on as a consultant to these companies. I teach at the university for free, obviously. That's my mission. That's something I just love to do. And I have my book author cap on, as I'm writing my second book right now. And I have a speaker cap, which means that I give about now 80, 90 speeches a year, which is my limit, probably. That's what I said for 70 last year, but we'll see next year. Which means that my position is very special because I don't practice medicine. I never wanted to practice medicine. That's a key point. But through my social media networks of tens of thousands of doctors worldwide, I try to get as much feedback as possible from them to see which points, in which points we can improve healthcare and how I can help them or how we can help patients and vice versa. So based on this feedback, I try to help them through the missions I'm having. Plus, based on this very special journey of mine, I try to live well. So that's why I said it's magic, because my career path is not a very usual one.
You know, I think, I mean, just to put it bluntly, I don't think it's sustainable that we can have physicians really, over the long term, engaging meaningfully without some sort of time attribution or reimbursement. I think in the future, I probably would see large organizations really allocating time for providers to be able to do this in some meaningful way. It would be a marketing thing played on one part, but.
Well, and this is one of the roles that patient communities play. You know, as I joined a community of kidney cancer patients that my doctor referred me to, ACOR, which has now moved to Smart Patients, Ronnie Zeiger's new company, and the members of that community collect and share what they've heard from their doctors. You know, yeah. So that provides real leverage and liquidity for those inputs. And you know, it's funny. Real value can transfer through that channel. In my case, my oncologist says that he believes that the information I got from ACOR on how to deal with side effects probably contributed to saving my life. Right? And that information I got from the other patients, not directly from him. So it's this multiplier effect, that really...
We'll take a question over here.
Hi, my name is Michael Weiss. My Twitter address is @hospitalpatient. A lot of people may know me already by now with all the questions I asked. But this is for Dr. Heiser. I hope I'm pronouncing it right. It's a comment and a question. I thought your presentation was spot on about, the accuracy of web health data. But I think there's one aspect that you didn't address, and I don't think that's been discussed. Having Crohn's disease for 30 years, technology over the past 10 years has helped me greatly manage my disease. But it's not from objective data that I get online. It's from communicating with other patients. It's patients sharing their experiences, what their side effects, what are certain medications. It's participating in chronology.com, a patient community, or participating in Lisa Field's Tuesday night tweet chat, healthcare leaders. What are your respective opinions on this sort of, it's subjective data, but as patients, we're able to weed out what's real and what's sort of, well, that's not really a real patient.
So I'll comment to that, and thank you for bringing that up. That's actually an excellent point. There is the role of the communication amongst patients, and for me, again, I'm all about the data, and you've heard me say it ad nauseum. I'm going to use the example of breast cancer survivors who are using aromatase inhibitors. That's a very challenging drug to take for women from a sexual perspective. It causes a lot of sexual dysfunction in women, and it's not really being discussed. It's not an issue that oncologists bring up very often. They don't talk about their sexual function. Their oncologists are talking about keeping them alive. So there's a lot of web chat about what's your experience, what have you tried, what have you done? And I think in those scenarios, I think that's very important, because a lot of those patients will then seek me out and come to me, and that's how the discussion starts with me. So I think there is a very important role for the subjective chat amongst patients and people who are experiencing certain medications or certain illnesses, and what their own challenges have been and what's worked for them, and that engagement with the physician to bring that to the table. Thank you for bringing that up.
Oh, sure. Let's help Leah out. She's new to a public role, and Dave and Bercy, as kind of experts who've been in this for a while, if you were advising a young woman who was starting up public presence and was trying to get the word out about sexual health, what would you advise her to do, or how could she really make a splash or get her word out there?
A lot of people ask me about starting a blog, like, how do I do it right? Like I don't want to look incompetent, whatever. I just say...
And if anyone wants to step to the mic, too, and offer any input, that'd be great.
I just say be yourself, which it seems to me you're not having any trouble doing. Listen, be open, don't expect the world to show up automatically, in the next few months.
So be human is what you're saying.
Yeah, be yourself, be open, be authentic as you would be meeting somebody at a reception. I don't think you're going to have any trouble with that.
Thank you.
I mean, the only big sin, in my view, I know sin's a value judgment word, is if somebody shows up and wants to be arrogant.
Yep.
Like, well...
I could save you plenty of time. I've made, I think, a lot of mistakes as a blogger myself. I've written 5,000 entries, so I've made some mistakes. Just a few...
He blogs every day.
Pieces of advices. First, be human. That's a very good point. Second, do whatever you do online. Just the things that you would do in the real world. There are no differences. Online world and the real world are the same in every aspect. It's a bit faster and interactive, but these are the same. Third, don't feed trolls, because they are everywhere, and please don't feed them, because they will come back every day for more food. And
could you be more specific?
Yeah. Elaborate on that for me a little bit, because I think I've experienced that recently.
My first social media experience was in Wikipedia. I became an administrator in English Wikipedia in the medical entries. And in Wikipedia, throughout my first 3 years, I learned exactly how to deal with troll people who come there to leave comments that will lead to nowhere, just to bad places, no positive or even constructively negative things, nothing like that, just questions and things they ask. if you answer anything in any way, whether it's good or not, doesn't matter. They will come back to ask more or to say more things. These are trolls. They never help. They are useless. If you get a comment on your blog the first time from a troll and they try to harm you with their thoughts, with their words, the best thing to do is delete, just like that, one click. It will not.
We have a comment from
Yeah,
the
sure.
audience here, too.
Thank you. It's good
So,
feedback.
yes, my name is Alexander Borva. I'm an orthopedic surgeon from Europe. And last 2 years I've gone into the digital space. So I have a startup that I'm doing. It's more skin diseases where you take pictures and you can send them to us. My question is about this patient social media. We see a lot of negative talks and things like a little bit. What I find when I go into social media and medical space, there are a lot of people who can't find what they're looking for. And I've been thinking about that. For example, all treatments today, there's about 40% of treatments, any kind, is placebo. So when you believe in something, you're taking it and you're going to get better, about 40% of that is placebo. Is this somehow we can get the social media where it's like all negative and try and make it more positive? So if we find negative patients on the media, that we can reach out to them and be more positive to them, and somehow they can get better because it's like placebo.
Tough one. Any ideas?
Can you do that in real-life communication easily?
I mean, my experience is if a patient comes to me and I don't give them a prescription or some kind of treatment, they're not very happy with my visit. But every time I write a prescription for some kind of painkiller, they're satisfied with my visit.
Oh, and that's true with or without social media, right?
That's the point.
So I'm trying to get into that social media space where people are not very happy with the treatment they've been getting, but if you can reach out to them and make them more positive and they think that the treatment they're having is better, I think 40% of that placebo effect might actually get into that.
That seems very individual to me. I'm not sure why you would want to do that on a network situation, but
I wouldn't use it as a strategy personally.
But for example, Twitter. You can see on Twitter, if you have some keywords, you can find which people are depressed, right? And you can maybe reach out somehow that that depression, that they be more happy.
thank you. I guess we're winding down just a little bit here. I just wanted to.
We're allowed to end early if we're finished.
It's
I've
okay.
been standing at the mic for quite some time.
Oh, I'm sorry.
Back here.
Gosh.
I'm very sorry.
Patiently.
Go ahead.
I just wanted to talk a little bit. It's more of a comment, so pardon this, but I now understand why my dean of nursing at UCSF sent me here, because I think that nursing is sorely lacking at this table, and I think it's just a matter of being a little bit behind in technology. I can't speak for all of nursing, but I did want to say something about patient empowerment. Empowerment theory actually comes from a Brazilian educator, Paulo Freire, the pedagogy of the oppressed, and he was the first person that sort of brought this in nursing in this collaborative process of education as a neutral process, not as a didactic or hierarchical process. And patient empowerment theory has been integrated in nursing for quite some time, over 2 decades. Marty Fennell at Michigan, a diabetes educator, advanced practice nurse, has been using this model and promoting it in diabetes care for many, many years. Patient as the center of their care and the healthcare provider as the collaborator. And so as healthcare provider, as a collaborative part of that care, but the patient is center. So if anyone's interested in sort of the history, it's really clear in the field, and nursing has done a lot of research on this. For example, over 20 years in my practice, I've been doing diabetes simulation with all of my fellows, residents, nurses that I teach, where they are taught to take on and live with diabetes for a period of time. Well, you can't live with it. You can never know the fears and worries about complications and low blood sugars and high blood sugars, but you can certainly empathize more greatly with a patient when you take on the tasks of diabetes.
Dave has a comment he wants to make.
No, when you're finished.
So anyway, I'm just sort of making a commentary that I think I need to take this on as sort of one of my missions to bring nursing to this table because we are an under.
Also one other person.
Anyway, thank you. Clearly underrepresented here, but I'm taking culpability for that.
Right.
Sure. So the Sarah Green, who used to be health editor at the New York Times and was one of the co-founders of our Society for Participatory Medicine, did a blog post about that book, Pedagogy of the Oppressed, a couple of years ago when her son, who was in India at the time, discovered it. She took a passage about and changed the words teacher and student for doctor and patient, and it just read perfectly. The great question here, all right? I said there are an awful lot of people who will present a thought at an academic conference, and that's the end of it, all right? Given that the day-to-day reality today is still that patients who try to speak up in a clinical transaction very often get shut down by clinicians. What do we do now to get out there and change that reality? You know,
well, in diabetes, there's very, very clear evidence that goals should be set by patients, for instance. And this is scientifically shown, and you can, as a center, become recognized by certifying bodies that you're promoting that kind of. But it's my responsibility as running a program like that, for instance, to train the people to do patient-centered goal setting. It's not easy.
Let's talk after the session.
We're going to take another question.
Yeah.
Yes.
Thank you.
Microphone on, please.
Hello? There we go. My name is Deanna Attai. I'm Dr. Attai on Twitter. I'm a breast surgeon. I co-moderate the Breast Cancer Social Media Tweet Chats, BCSM, that patients Jody Shager and Alicia Staley founded. And my advice to physicians that are getting involved in Twitter, listen to the patients. And don't be afraid to engage with the patients. One of the reasons that BCSM has been so successful is we have a really dedicated group of surgeons, of oncologists, of radiation oncologists. It's basically a multidisciplinary cancer center. And we listen to the patients, we engage them, we're available even outside of the chat for comments and just clarification of points. And I think that's the most important. Be yourself, be authentic, be exactly what you do every day in your clinic. Just do it online. But don't be afraid to reach out to the patients and get involved.
That's an excellent point, but there's an inherent assumption is that physicians only talk to patients in public. Physicians sometimes talk to other physicians as well. It really depends on who your audience is.
Absolutely.
And so when physicians go public, very often we assume the only thing that we can do is talk to other patients. In reality, we can talk public policy, we can educate other doctors, we can talk about technology. There's all kinds of other things we do, but that's an excellent point. In advice for Leah.
Yeah.
So I guess we're gonna wind it down here. Any just closing thoughts on what's next?
I want to point to two particular things. The first physician website recognized by the AMA was created by Alan Green. It's still operating, drgreen.com. He's here today. And as a new grandparent, I have a new level. All this becomes more relevant.
Different perspective, right?
Things like his White Out campaign. Stop giving kids white rice as their... and the phenomenal power of social media changed pediatrician attitudes in less than a year.
Right.
Amazing. And if you want to understand engaged patient communities online, the best disease for that is diabetes. The two classic diabetes patient blogs that I love are Six Until Me, Carrie Sparling, who's here, and Diabetes Mind. They, by nature, have to be engaged in maintaining their care.
Leah, anything?
Yeah, so what I've learned is the possibilities are endless. I'm so excited to just jump right in, and I think for me is getting more involved with the e-patient community. Sometimes that might be a little hard in sexual health. I don't know how many e-patients want to be that vocal in that area, but I think when it comes to cancer and sexuality, I think that's an area that e-patients can really be a big part of it. So I am so excited to have learned so much from my three panelists and from audience members as well. So thank
But
you.
it's amazing to hear that because this should be the most exciting time to be in medicine. Physicians are more empowered than ever as our patients. So, Percy.
I think no matter how much we support the e-patient movement, e-patients won't be able to revolutionize medicine without preparing medical professionals for the same. So I believe we have to keep on improving the medical curriculum itself, plus even preparing physicians and professors for the same digital skills.
Great. Let's thank the panel. Thank you.